Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be taking you through 20 common neurological conditions along with targeted exercises you can perform to speed up your recovery and eliminate your pain. Now let's get started. The 14th neurological condition is tarsal tunnel syndrome, which is when there is compression of the tibial nerve at the ankle, leading to pain and numbness in the sole of the foot. To treat this condition, nerve gliding exercises are terrific when prescribed correctly, specifically the tibial nerve gliding exercise. First thing that we want to do is we are going to flex that knee to 90 degrees. And then, first step in the actual movement is we want to go into maximum hip extension while maintaining that knee flexion of 90 degrees. And we're going to do that for 3 to 5 repetitions. After 3 to 5 repetitions, we want to go ahead and ask ourselves, are my symptoms getting better, worse, or staying the same? If your symptoms are either getting worse or staying the same, we would want to stop immediately. There is no need to continue with the exercise. We do not want to exacerbate your symptoms. However, if your symptoms have gotten better, what we would do is we would go ahead and while maintaining that knee and hip inflection of 90 degrees, we're going to go into hip extension, 20 additional repetitions. Let's say you've done the hip extension and you still haven't noticed any reproduction of your symptoms. We could build tension on the nerve. So from here, we would go into hip extension and then add dorsiflexion for 3 to 5 repetitions while maintaining that hip extension. And then once again, we're going to ask ourselves, have my symptoms gotten better, worse, or have they stayed the same? If you've noticed that your symptoms have either gotten worse or stayed the same, we would immediately stop with the exercise. We don't want to continue and exacerbate your symptoms. However, if your symptoms have immediately improved, what we would do is flex that knee to 90, take that hip into extension, and do 20 additional repetitions of ankle dorsiflexion. Now, let's say you've done the hip extension, you've done the dorsiflexion, and you still haven't noticed a reproduction of your symptoms. The last step to build more tension onto the nerve is we would go ahead and we would add eversion of the ankle. So we're turning the sole of the foot away from our body. So we maintain that hip extension, dorsiflexion, and do 20 repetitions of 3 to 5 repetitions of eversion. After 3 to 5 repetitions, we once again want to check in with ourselves and ask ourselves, have my symptoms gotten better, worse, or have they stayed the same? If you've noticed that your symptoms have either gotten worse or stayed the same, we would immediately stop with the exercise because we don't want to exacerbate your symptoms. However, if we have noticed an immediate improvement, what we would do is go ahead and we would perform an additional 20 repetitions of eversion. That's if we just want to build tension from proximal to distal. We have a few different options that we could work with. We could also turn this into more of a little bit of a gliding exercise by adding tension to one end while removing tension at the other. So for this, there's 3 main components. We've got the hip extension, the dorsiflexion, and the eversion. When we are focusing on the hip extension, we're building tension proximally. And then as we go more into dorsiflexion and eversion, we build the tension more distally. If we wanted to get more of a gliding technique, we would build tension at one end and remove tension at the other, and then vice versa. So when we go into hip extension, we would want to go into plantar flexion inversion. That way we're building tension at the proximal attachment and relieving tension at the distal attachment and putting it under slack. And then what would happen is, as we go into hip flexion, we would go into dorsiflexion eversion. So we go hip extension, plantar flexion inversion, and then we do hip flexion, dorsiflexion, eversion. When we go into hip flexion, the proximal attachment is under slack. And when we go into dorsiflexion eversion, the distal attachment is under tension. When we go into hip extension with plantar flexion and inversion, the proximal attachment is under slack. The proximal attachment is under tension. The distal attachment is under slack. Same thing though, we would do 3 to 5 repetitions, check in, see if things are getting better or worse. If things are getting worse or staying the same, we don't do any more because we don't want to exacerbate the symptoms. And if our symptoms are immediately improving, we would perform an additional 20 repetitions. So those are a few of the different options that we have to try and release some tension on the tibial nerve. The 15th neurological condition is cubital tunnel syndrome. That was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.